Welcome to my YouTube channel Pathology Decipher. In this video, we are going to learn on topic cell adaptation. Cell adaptation is an irreversible change in size, number, phenotype, metabolic activity or function of cells in response to changes in their environment. There are four distinct forms of cell adaptations. They are hypertrophy, hyperplasia, metaplasia and atrophy. First, let's deal with hypertrophy. Here, the size of the cell is increased due to addition of intracellular structural components. Therefore, the size of the affected organ is also increased. The hypertrophy may be pathologic or physiologic. Example for physiologic hypertrophy is enlargement of skeletal muscle fibers in bodybuilders. For example, the enlargement of bicep muscles in the bodybuilders. The hormone-induced enlargement of uterus during pregnancy by the estrogenic hormone through the estrogen receptors. In this picture, we are able to see the normal uterus and the hypertrophied uterus. In pathologic hypertrophy, the striated muscle cell present in the heart and skeletal muscle respond to the increased metabolic demand by undergoing hypertrophy. The cells synthesize more proteins and increase the number of myofilaments. Therefore, the strength and workforce of the muscle, that is the myocyte, increases as a whole. In this picture, we are able to see a normal myocyte, which is the cell of the heart, is hypertrophied in response to increased load. It is the cardiac hypertrophy where the left ventricular wall thickness is highly increased. Let's see about the mechanism of hypertrophy. When the increased load is sensed by the mechanical sensor, it stimulates the signaling pathway, which in turn activates the transcription factor, such as nuclear factor activator T cells, myocardial enhancing factor 2, results in increased expression of genes that encode the muscle protein. As the result, there is increased mechanical performance and decreased workload. Next, let's move on to hyperplasia. Increase in number of cells in response to a stimulus occur in hyperplasia, so the cells that are capable of division undergo it. Hyperplasia may be physiologic or pathologic. Physiologic hyperplasia occur due to action of hormones or growth factors, so the functional capacity increases and there will be a compensatory increase after damage or resection. For example, an individual who donate the liver for transplantation, the remaining cells proliferate so that the organ soon grows back to its original size. Another example is the bone marrow undergo hyperplasia in response to the deficiency of mature blood cells. Example for pathologic hyperplasia. In proliferative phase in endometrium by pituitary and estrogen hormone. It comes to halt, that is the phase comes to halt by increasing progesterone level, but when the estrogen level increases more than the progesterone level, there will be hyperplasia of endometrial glands that may develop a risk of endometrial cancer. Benign prostatic hyperplasia is also another example, and viral infections such as papillomavirus that cause skin warts and mucal lesions is also an example for pathologic hyperplasia. Mechanism of hyperplasia. That is, the hyperplasia is a result of growth factor driven proliferation of mature cells and increased output of new cells from tissue stem cells. The growth factor get engaged on receptors in living cells and activate the signaling pathway. As a result, cell proliferation occurs. Next, let's move on to atrophy. There is decrease in both size and number of cells, results in decrease in size of the organ or tissue. Atrophy can also be physiologic or pathologic. Example for physiologic atrophy is disappearance of notochord and thyroglossal duct during fetal development and the decrease in size of the uterus after parturition. Pathologic atrophy can be localized or generalized. Let's see about the causes of pathologic atrophy. A person with a fractured bone who has put a plaster, or the person who is in a complete bed rest undergo disuse atrophy. Denervation atrophy, where there is loss of innervation. Damage to the nerve leads to atrophy of the muscle fiber supplied by it. Inadequate nutrition. In protein calorie malnutrition, after adipose tissue reserve is depleted, the muscle cell proteins are utilized leads to cachexia, where the muscle wasting occurs. Diminished blood supply due to arterial occlusive disease is also a cause for the pathologic atrophy. The brain on the left side is normal and the brain on the right side suffers from atherosclerotic disease, so that due to diminished blood supply, the gyri narrows and sulci widens. Loss of endocrine stimulation. Loss of estrogen after menopause causes atrophy of the endometrium and the breast, and pressure that causes tissue compression. That is, the enlarging benign tumor exerts pressure on the blood vessel and cause atrophy of the surrounding tissues. Mechanism of atrophy. There is decreased protein synthesis and increased protein degradation. The protein degradation occurs in the ubiquitin proteasome pathway. The activated ubiquitin ligase attaches the ubiquitin to the cellular protein in the proteasome and the cellular protein is degraded. Next, let's move on to metaplasia. Metaplasia is a reversible change where one cell type is replaced by another cell type. The common epithelial metaplasia is the columnar epithelial cells are replaced by the squamous epithelial cell. For example, in cigarette smokers, the ciliated columnar epithelial cell of the trachea and bronchi is replaced by stratified squamous epithelial cell. And in Barrett esophagus, the squamous cell is replaced by columnar cell. The mechanism of metaplasia is reprogramming of local tissue stem cell. But metaplasia does not result from change in phenotype of an already differentiated cell type. Like, share and comment my video. Do not forget to subscribe my YouTube channel. Thank you for watching.